This video is to show you how to use favourites and care sets to try to speed up the ordering process within EPR. As I'm sure you are fully aware, to order a test from scratch requires you to type it in, select it, and then fill in all the various mandatory fields. This one's only got 2, but often, as you know, they have many more, so that's quite time consuming. If I can encourage you to use departmental folders where at all possible, so I'm going to go into rheumatology. If I right click on this now, I can set it as my home folder, so that now if I go and place an order, it takes me straight to the rheumatology folder, and here I already have a full blood count. But if I do this, I still have to complete the order entry field forms, which I would like to avoid if I possibly can, because I order that test on a regular basis. So now I'm going to use a care set. The care set's this little icon here is for a care set, and in this situation I'm going to order a new care set for somebody who I think's got a connective tissue disorder. And here you can see the tests that are on that care set, but more importantly, all the details for the order entry form have already been completed, so I don't need to necessarily do all of these tests. I'm going to remove some of them, but I want to do those ones for say, and if I do this now, you can see that the full blood count, ESR and urea and electrolytes have all been requested for me, but most importantly those mandatory fields have already been completed for me and a reason has already been applied. So if this is something that you do regularly, certainly as a department, then that's a much more efficient and more rapid way of doing things than having to type everything from scratch. In addition to that, if we go and look at the dermatology folder, for example, we have an azathioprine 6-weekly monitoring care set, and in this care set we're going to order a full blood count, renal function and liver function every week for 6 weeks. Again, all the details have been filled in for me, and it's automatically going to add in it's going to add from today's date 7 days, 14 days, 21 days, and with a couple of clicks I can order all of these things at the same time. So if you have standard workflows where you always do the same thing every time, this is a hugely efficient process. And another example of that is in urology, the radicals prostatectomy follow-up care set. If you want to get very clever, we have a combination of blood tests, clinic follow-ups, follow-ups with multidisciplinary team members. We could add in radiology to this, we could add in referrals to this, so you can create complex care sets for anything that you do in the same standard fashion. Similarly, under inpatients, we have a routine monitoring care set for inpatients on the ward. I think we still do far too many blood tests, but for the juniors, this is a very helpful care set that I can order a full blood count and urea electrolytes, and add others if I want to for the next phlebotomy round, and then I can add a couple of days, and I can add 4 days, and I can add other blood tests if I want to. So again, hopefully this helps to speed up the ordering process, but also helps to discourage people from doing too many blood tests too frequently. If the care set doesn't really fit your requirements, then you can create your own favorites. And again, I would encourage you, if you're going to do this, to pre-complete as many of the data items as you possibly can. If you click this star, it takes you to the favorites folder, which at the moment for me is blank. So I am going to add in a 24-hour urine calcium. That's a routine collection. The reason is renal stones, and that's urine, so I'm going to add that to my favorites. I'm also going to put in, for the purposes of this, I'll become a urologist, though I'm sure the urologist would prefer that I wouldn't. So I'm going to put in a 4-week urology follow-up, first available, and I'm going to save that to my favourites. But while I'm at it, I'm also going to do 6 weeks. I'll save that at the same time, and I'll add 3 months and 6 months, because those are the standard follow-up intervals that I use. So now if I add a new order, if I go into this little arrow beside the star, I can organize my favorites. There they are. What I'm going to do is I'm going to create a folder called urine, and I'm going to create a folder called clinic, and I'm going to put the calcium in there. I'm going to put these in here, and now when I place an order, I can go straight to here, and if I want straight to my favorites, and I can click on the urine, or I can go to clinic, and then I can just choose whichever of these I want. I want to follow this patient up at 6 months. Done. And again, all my follow-up requests have fields have been completed. So I hope that's useful. If I can encourage you to use caresets and or favorites as much as possible, I think it dramatically speeds up the process for you. And if you want to know how to request a careset or modify a careset or create caresets for your departments, I'll do a separate video which will show you how to do that, and I hope that you found that useful.